Right. So quickly looking at another disease condition of the thyroid gland. This is what is known as a toxic multinodular goiter. Toxic multinodular goiter. Right? Toxic multinodular goiter. Right? So for the toxic multinodular goiter, it's what is known as, or it's also known as Plummer's disease. So it's a condition where multiple nodules in the thyroid gland, they become active. When they say they are active, like they start inducing the production of what? Thyroid hormone. So you have hyperthyroidism. So they will produce excess thyroid hormones, and this will now lead to what? Hyperthyroidism. So it's often associated with iodine deficiency, which can now lead to thyroid enlargement and development of the nodules. The nodules become active, then they start inducing the production of the hormone. So mutations in thyroid receptor can also cause the nodules to become what? Autonomously what? Functional and toxic. Right? So symptoms is there's hyperthyroidism. So everything associated with hyperthyroidism: heat intolerance, rapid heartbeat, tremors, irritability. There's a visible or palpable goiter, that's enlarged thyroid gland. In severe cases, it can cause compression symptoms like difficulty swallowing or breathing. Okay. So diagnosis is you get to see that what thyroid stimulating hormone levels will be elevated. Okay, thyroid stimulating hormone will be low because the thyroid gland is actively using the stimulating hormone. You understand? Then if you do for T3 and T4, you see that what they'll be high. So thyroid scans can also check it. Ultrasound will now evaluate the size. Alright. So alright, so medication, basically there's too much thyroid hormone in the body, so you want to use anti-thyroid drugs, drugs that can reduce the levels. The radioactive therapy, just to shrink and destroy the overactive thyroid tissues, right? Then thyroidectomy can now be done to take out the large goiters.